Good evening, all of you. Happy International Friendship Day, belated. One day just gone, and we are here. We have completed 1 month. Our shows. We started from 1st July, and today is 31st July. So it's. I would like to congratulate my team also, who has been with me 1 month के journey में. हमने आपको बहुत सारे episodes में बहुत सारे exposures दिए हैं. I hope you are liking, enjoying, and gaining out of it. So, this is Megha B. Pitwa, your host. I'm a spiritual advisor, I'm a life coach, I'm a numerologist, tarot card reader, also an educationist, where I believe in giving the base, clearing a base of a child. बोलते हैं ना एक नींव क्लियर करना. एंड जो आपके शोज है उनको आपके रूबरू लाना. तो आप कुछ कहते हैं, हम सुनते हैं. तो कहिए और सुनने का जो फर्क है वो हम आपसे रूबरू कराते हैं. अब हम लोग ने एक सीरीज करी थी अनसंग वॉरियर्स. वी स्टार्टेड विद दिस एंड इतना प्यार मिला है मुझे आप लोगों से कि आज हमने ना उसका रिपीट टेलीकास्ट समझ लीजिए. एंड वी हैव डॉक्टर अनीता सोनी फ्रॉम डॉक्टर H Hiranandani Hospital. She's a MD Gynaec there, and she's a very senior doctor. She's got a very good team to work. And जो हमारे last sessions में मेरे को बहुत सारे feedbacks friends के आए जो मुझे बोल रहे हैं कि डॉक्टर का शो was the best, one of the best. जो नॉलेज हमको डॉक्टर ने दिए ना वो अभी तक किसी को कोविड के बारे में नहीं दी. So let's salute again. So let me invite Dr. Soni and Dr. I really, मैं personally भी I'm thankful जो चीजें हम लोगों को seriously नहीं पता थी वो आपने बताई. तो कोविड का डर एक प्रेग्नेंट लेडी को या एक नॉर्मल लेडी को या 40+ लेडी को डर लगता है कि भाई गायनेक के पास है बिकॉज जो इश्यूज हम लोग फेस कर रहे हैं. So I want you to throw some light on that.
Thank you for having me over for the second time, and I'm so glad कि मैं दूसरों को help कर सकी with whatever little information I could part on that day. This is all courtesy Dinesh Thakur, who I've known for the last so many years, maybe about 12, 13. But thank you very much for inviting me, and I'm so glad to be back again. Well, like I told you last time, COVID हमको हमारे books में ना When I studied 30 years ago, एक ही लाइन था कोविड के बारे में और हमने कभी किसी ने देखा नहीं ना सुना था. तो we were all scared of this. और जब अमेरिका और कनाडा में बाहर आया तो हमको लगा कि we are very far away from it. हमको कभी कुछ नहीं होने वाला है. And when it came to India in March, we all started getting very petrified. Like I told you, I did the first case in March. And till now, I'm continuously working with COVID patients. Fortunately, unfortunately, month of June end, I was admitted with COVID. So not only have I been able to help patients, but I know what it is to suffer from COVID because right up to lung involvement, to remdesivir, सब हो चुका हमारे साथ. And I'm grateful for the love and affection that everybody sent and all the prayers. And I'm out of it. And so there is nothing to get so scared or worried about. Does it cause you problems? Yes, it does. So is a woman in danger because she gets COVID? COVID by itself is frightening. पता नहीं चलता किसको कितना होने वाला है. The younger you are, the better you are. When you cross 50, that's where the complications become the most. But for women, let me reassure you that even when we get infected, our infections are not as high or as bad as what happens with men. When you actually go to see, the mortality rates are much higher in the male patients than in the female patients.
Okay. Again, ये भी हमको नहीं पता था मैम. I'm sure.
So there is information that is because women, like have 2X chromosomes and men has 1X and 1Y. So they say that the fact that we have 2X chromosomes, we have got a better tolerance to this RNA virus than the men.
So we are more safe.
We are relatively more safe. We'll use the right terminology.
Relatively more safe. That's very great. So, ma'am, I'll start with one simple question which my friends are asking me because they are 40 plus. It's a very important question. When I am 40 plus. So, the phase of a menopause, how should we take care? Being a
Okay.
gynec, I understand it's a COVID time, but there are people who have gynec issues and COVID time में वो डर रहे हैं.
So
Uh,
let me start addressing that. See, COVID menopause first of all is absence of period, and absence of period for a year. Now today's day and age, nobody is getting menopausal at the age of 40 unless there's something hormonally really wrong with them. The going age for menopause today in the country is 50, 49, 50. So people are not getting early menopause. It is proper menopause is 50, and of course you have family history. Like if your sister and your mother have had menopause at 50, 55, less chances that you will have menopause at 40. So these are things that you have to accept. My problem is patients, because of fear of reaching a gynecologist, are ignoring chota symptoms like irregular period, extra painful period, and by the time they are coming to us, they are missing out on major tests. Cancers are being missed. So what could be diagnosed as stage 1 or very minimal, by the time 3 months 4 months later they are going to stage 2, stage 1B. So what could have been treated with just very minor something is landing up unnecessarily because of the fear of reaching the proper hospital or going to a tertiary care center. Choti jagah, like today I saw a patient with an ultrasound report. Last year, the lining of the uterus was slightly thickened. Now she's had 4 normal children, 4 deliveries. She's 52 years old. But a normal doctor said, "Ye theek hai." I did a clinical examination and I saw growth on the cervix. अब भी अगर वो लास्ट ईयर 2019 में मेरे पास आते तो मुझे तो सिर्फ वो खाली एक डीएमसी करना था. अभी I have landed up with a growth on the cervix. So I'd land up with slightly more treatment required than now. So what has happened is, because of the fear of reaching a tertiary care center, because of the fear of COVID around, people are delaying going to tertiary care to people who have more experience and more knowledge on these things, and unfortunately छोटी चीजें बड़ी हो रही है.
Exactly. मतलब मोल का पहाड़ बन गया है और तब जा रहे हैं.
Exactly. And और फिर क्या होता है कि डॉक्टर अभी तक तो सब कुछ ठीक था, हमारे वाले डॉक्टर ने बोला कि कुछ भी नहीं है, और आप सडनली बोल रहे हो कि इतना सारा है, हमें तो पता नहीं. Now instead of me going in hindsight and criticizing somebody, मैं एक ही चीज बोलूं कि अभी आप ये सिचुएशन में हो, अभी यहाँ से आपको कैसे निकाले और कितना कम से कम करके आपको सबसे ज्यादा फायदा हो वो सोचो, पीछे का मत सोचो. Exactly. But it kind of gets too much for patients, and their treatment, diagnosis and management is getting delayed because of fear of entering into the hospital. And I keep telling patients कि भाई मेरे हॉस्पिटल में हम कोविड लेके घूम नहीं रहे अपने खीसे में कि हम दान करें सबको, नहीं तो how are we functioning?
Exactly.
We've been functioning since March. So please understand that there is no fear of reaching Hiranandani Hospital or Leelavati Hospital or Nanavati Hospital and call us COVID hospitals. See, we are doing our service to society, but being a part of a huge infrastructure, we can separate COVID from non-COVID. आप छोटी जगह में जाते हो जहाँ पे कोई separation नहीं होता, तो you're putting yourself in more danger, because कौन COVID वाला है ये आपको थोड़ी पता है, हमें भी नहीं पता है.
Exactly.
So that's where the problem is.
I remember मेरे फादर से बात हो रही थी. I think I must have spoken about this. मैंने बोला पापा ये वो, तो पापा बोले देखो भाई, पहले तो एक चीज जान लो, आप जिससे मिलो उसको कोविड है.
हाँ, परफेक्ट.
मिलो किसी से ये सोच के मिलो कि उसको कोविड है. अब आप कैसे मिलोगे अब आप देख लो. हाँ. तब से आज कल मेरे कोई घर में देने को आए, कुछ सामान देने को आए थे, किसी ट्रीट टाइप थी वो, तो सबसे पहले मुझे घर में मास्क पहना दिया गया, फिर दरवाजा खोला गया. तो दिस इज, मैं बोली यार अच्छा नहीं लगता, बट एक्चुअली इट इज रिक्वायर्ड. That
it is absolutely right. So running away from going into a tertiary care center or into a big hospital, they are actually choosing to go to छोटा जगह to deliver, saying कि इधर कोविड नहीं है. अरे यार हम थोड़ी ना कोविड दिख थोड़ी रहा है कि हमारे पास आ रहा है.
It's an unseen danger.
Yes, we have patients. I'm not denying it, but because we belong to big places, the infrastructure is separate. वो पूरा फ्लोर के फ्लोर हम आइसोलेट कर देते हैं. अदर हॉस्पिटल्स में पूरा बिल्डिंग आइसोलेटेड है, एंड द स्टाफ हु इज देयर डजंट इवन स्टे देयर. दे आर केप्ट आउटसाइड ऑफ द हॉस्पिटल, सो दे आर कंप्लीटली सेपरेट. तो इधर का उधर नहीं होता, चम्मच स्पून भी नहीं होता, पता. So that much care is taken, and वो कौन care इतना बड़ा ले सकता है? Only people who have got big hospitals. Facility. छोटा जगह थोड़ी नहीं है, facility है.
Exactly. So जो लोग जो डर रहे हैं, अच्छा ट्रीटमेंट को मिस कर रहे हैं, I think they should get inspired by this session which we are trying to do. कि सारी facilities available है. COVID is a fear, it is an unseen danger, but सब चीज उसके साथ में taken care हो रही है.
Exactly. और COVID see, Raja, it is not only in Bombay or only in X hospital. It is there all over. पूरा दुनिया को affect कर दिया है. So we have to logically, demarcate कि मुझे treatment करवाना है. You have to only come if you have a problem. Suppose you have no symptom at all, कौन बुला रहा है? Hospital मत ही आओ ना. But if you have a problem, don't get scared.
Picnic बनाने थोड़ी ना जाना है.
Exactly. So please, if you have a problem, like we were talking about the menopausal patient, if you have suddenly 1 year में period बिल्कुल नहीं था, suddenly 1 year के बाद थोड़ा सा spotting हुआ, तो ये मान के मत चलो कि सब कुछ ठीक है. जाके डॉक्टर के पास मिल तो लो. Find out, is it hormonal? Is it a variant of normal? Or is there something in the last 1.5 year that are having chances of growth in your body? Like if it is a very small pre-malignant or a very early malignancy, छोटा चीज बहुत easily हो जाता है, and it can be taken care of easily. We have all started doing our routine work, routine OPDs. So your routine checkups like your pap smear, your ultrasonography, your mammographies, why do you want to delay these things?
मैम ये कितना मतलब this test are मतलब कितना frequent कराना चाहिए these tests?
Okay, the answer is it depends on the age of the patient. If the patient is in the normal reproductive age, sexually active, so between the age of 25 and 45, normal sexually active patient, then she can get her pap smear done once every year for 3 years, and after that, if 3 years successively it's been normal, she can get it done once every 3 years, no problem whatsoever. This is as far as the pap smear is concerned. If you've had multiple sexual partners, if your husband has been cheating on you, if you have any abnormal vaginal discharge, and or you are of the elderly age group, you're having unprotected sex, you are exposed to developing cervical cancers, then for that high risk population, you would like to do it once every year. If you are single partner sexual activity, there is nothing to get worried about. The more often we would like you to do is your ultrasonography of the pelvis, because in our class of patients, that is the affluent class, the carcinomas of the uterus are much more common than of the cervix. When I was in the municipality, we used to see more cervical cancers than, because of hygiene and whatever. So that it all depends. And as far as mammography is concerned, that is very high risk. So self breast examination from the age of 25, I teach all my patients that you start examining your own breast with your hands. If you Google self breast examination, it is self-explanatory. Sab samajhta hai. Just do it na. So you will be the first person to pick up your problem. Unnecessary tests, exposure, radiation, वो सब कुछ करने की जरूरत ही नहीं है.
सही बात है. I think अब सब लोगों को क्लियर हो रहा है ये टेस्ट कब और कैसे कराने चाहिए और कहाँ कराने चाहिए, वो तो आप समझ ही गए होगे. जहाँ फैसिलिटी प्रॉपर हो, everything is taken care. So that has to be very important. So my audience, I am sure you will learn from this what ma'am is talking about. तो मैम अभी ये कोविड टाइम में नॉर्मल पर्सन आ रहा है, वो ये डर लेके आता है कि हम टेस्ट कराएंगे हमको कोविड हो जाएगा. तो आपने ऑलरेडी हमें बता दिया कि यू गाइज आर टेकिंग एक्सट्रीम केयर.
यस.
तो थोड़ा सा मतलब उनको स्टेप्स बताएंगे कि हाउ यू take care and how?
Okay. I'll tell you something. Now, there are two types of COVID patients. There is one group of patients who are totally asymptomatic, meaning there is, say, X has 9 months pregnant, needs to go for delivery. Say somebody requires a hysterectomy. Say somebody has tonsillitis, whatever planned surgery. So, like every hospital is doing an admission package, which is HIV, HPSAG, and HCV for every patient that requires surgery. Similarly, every patient is made to undergo a COVID test. COVID testing is of two types. One is the antigen test, which is done from the blood. Two is the swab test, which is the RT-PCR test, which is a swab which is taken from your nose and from your throat, and these two swabs are taken. The antigen test is very, very easy. Now, quite a few hospitals have got it. So, and the report is available in 4 hours. So, as soon as the patient is ready for surgery or is planning, normal patients, sabhi ko screening hoti hai. Now, why do you do it? Because you're exposing other people. Now, having said that, our OTs, operation theaters, are totally separate. We have one COVID operation theater, which is on the ground floor. And then we have an entire OT complex, which is on the second floor, which is for non-COVID patients. Delivery rooms are absolutely separate. COVID patient ke liye alag delivery room, non-COVID ke liye alag. So that is why we need to know who is COVID and who is non-COVID, so that we don't expose anybody as well as ourselves and the hospital staff. Having said that, we are all using N95 masks in the hospital. Per hospital mein rakhne se pehle, you will see all of us with N95 masks. That is the hospital staff. Do patients need to wear N95? No, you require a 3-ply mask and or even a cotton mask, which is 3-layered. Okay, simple mask is more. Why do we require? Because our exposures are higher. We don't know who is carrying what, and our viral loads are much higher than normal patient. आपका क्या होगा? आपका exposure एक बार ही होगा, हमारा दिन में 10 बार ही होता है. So when we pick it up, it is also individual के किसका immunity कितना है. Now, why did I fall ill from March to June? I was fine. Why is it in June that I picked it up? Because my exposure was continuous from March to June. I had not even a day's break. So finally, my body could not handle that exposure, which I was continuously having, and I got exposed. Otherwise, my immunity was fighting it. Nah? You will come on one day, so you will not pick it up. Now, another thing that all hospitals and doctors have requested is the one, with the valve, the mask with a valve.
I wanted to ask you that.
Please do not use that.
Ma'am, everybody is promoting that mask.
That is only for dust allergies. That is not for COVID.
Oh my God. Ma'am, ये पता ही नहीं है लोगों को. Seriously.
So that is the whole idea of us doctors coming out to talk, because we want people to understand. Now in my OPD, I have patients who come with that. I give them a 3-ply mask and I say, please wear this over that. Because we don't know whether you're symptomatic or asymptomatic or you're a carrier or no. Relative comes, he wo khok mere table pe karke jayega. Again, I'm getting viral exposure, na? So I have to protect my environment.
Exactly.
Okay, so this is as far as the masks are concerned. Once you go into the hospital, hand sanitizer and temperature check is right at the gate of the hospital. Nobody is allowed to enter without a mask. Nobody is allowed to enter without hand sanitizing your hands and temperature check. Once all that is done, you go to see your doctor. We are all giving appointments, only one appointment in half an hour. So in an hour, there are only 2 appointments, so that there is social distancing by virtue of no crowd. Okay. So we are giving only limited appointments. We are trying to discourage walk-ins as much as possible. Between cases, sheets are getting changed. OPD is getting cleaned down. Before I start OPD, the OPD has to be cleaned with sodium hypochlorite solution. Even the chairs in the waiting room are all wiped down with sodium hypochlorite solution. So, no exposure in any way. Now, when the patient comes, like I was telling you, see, jo patient ko bukhar, khansi, sardi, anything, they go directly to the fever OPD. They do not enter into the main hospital building. They are completely separate. There is a separate set of doctors over there who are seeing them, who are investigating. And when that person goes through the hospital, say to radiology or whatever, that entire place goes into lockdown, and complete wiping of the entire floor, sodium hypochlorite, doors, wall, everything is done.
मैम किसी को नहीं पता होगा इतना आप लोग कर रहे हो.
तो the whole problem, अगर आप आओगे नहीं आपको दिखाई नहीं देगा, और आप अगर कोविड नहीं हो तो आप रूटीन एंट्रेंस से आओगे, तो आपको क्या पता चला कि कोविड वाले एंट्रेंस से किसको क्या हो रहा है. हमारे हॉस्पिटल में 3 लिफ्ट रखे हैं सिर्फ कोविड के लिए, और बाहर के 3 लिफ्ट हैं वो नॉर्मल पेशेंट के लिए. तो नॉर्मल पेशेंट डज नॉट गो इन कोविड लिफ्ट. सो एवरीथिंग इज अलग, एवरीथिंग इज एब्सोल्युटली चेंज. नाउ टेल मी which nursing home or small infrastructure wala jaga can afford to have separate lift, separate this, separate that, wipe down. And for the staff which is doing fever clinic and that side, they are all in PPE. In OPD we are only wearing our mask and we are hand washing our hands 100 times. After every patient we wash our hands with soap and water.
मैम जल गए होंगे हाथ,
स्किन निकल रहा है, अरे मैनिक्योर पेडिक्योर भी नहीं हो रहा है, तो हमारे उंगलियों का तो हालत हो गया है. But we need, because we check every patient, so our nails are getting chipped, everything. But eventually we are hand washing is the safest thing to do. Patients come with mask, with face shield, with blue colored gloves on. That is all. You guys don't even require it. Yeah?
Correct.
If anyone requires it, it is the doctors. And when we started, हमारे पास ही नहीं था, दूसरा दुनिया भर सारे पहन रहे थे.
Exactly, सबने खरीद लिया था.
Exactly. So that is why the prices went up and everything. So now we've all got our own stuff. Now in the operation theatre, if you have a COVID confirmed or a COVID suspect, that is when we wear full PPE.
Okay.
Full PPE. Personal protective equipment. So in that we have a white pura suit, from head to toe we are covered. We wear N95 mask, uske upar sada mask, and there we wear a face shield, so that because when we are operating, when delivering, when cheete are falling, they fall on the face shield and not on our face. So that is the precaution that we are taking.
Ma'am, how you feel while wearing that? How अंदर क्या हो रहा होता है?
अरे हालत होती है, पता है, somebody like me, because I am big build, इतने पसीने छूटे हैं, I am menopausal, इतने पसीने छूटते हैं कि हालत हो जाती है. Then after, so we don, we go in. Before the patient is brought, we dress up. Then the patient is brought. On that, we wear sterile gown. Then before the patient is shifted out, we do doffing, which is removal of everything, which again takes about 15-20 minutes. Then we straight head into the bathroom for a shower. Hot water shower. देख हम बाल रोज धो रहे हैं, हमारे बाल रह ही नहीं गया, इतनी दजियां उड़ रही है. तू छोड़, रोज धो रही है क्या?
मैं भी रोज धोती हूँ मैम.
हाँ, every day horrible हालत हो गई है हमारी. Every day we come back from hospital, we shampoo our hair, we have a hot water shower, then we associate with our families. Till then we don't associate with family also. That's the only way. Even when I got COVID positive, no one in my family, my maid, like I told you, my husband, my daughter, my maid, everybody was negative.
That means एक जन कितनी केयर करा कि किसी को कुछ असर नहीं हुआ. Right?
Exactly. So, and we know, because see, my husband's a doctor, I am a doctor, both of us operate on COVID patients, so we have to be extra careful, because हम जो virus लाते हैं हमारे घर को, and our whole house gets wiped down with sodium hypochlorite solution, and jhadu pota is done with Lysol, Savlon and Lysol.
Okay. वो बहुत important है, सब लोग सुन लो कैसे झाड़ू पोछा करना है, क्या चीजें यूज करनी है. कोविड है नहीं है, but है.
You have to look at everybody as a potential COVID positive patient. Like your papa said, the minute you start doing that, you will start taking more care about yourself and your environment. Let me tell you, अपने आप को आप नहीं बचा सकते हो अगर आपने अगल बगल वालों को बचाया नहीं. Because even if you are negative, if they pick it up, they will give it to you immediately.
Exactly. So surrounding has to be taken care of. नॉर्मली कुछ लोग लाइटली लेते हैं मैम, जो मतलब अपना पर्सनली देखा है कि चले गए, अपना मास्क उतार के लिफ्ट में जा रहे हैं, कर रहे हैं, फिर
अरे लेटेस्ट स्टाइल इज मास्क इज तो अंडर द नोज और इट इज ऑन द गला. So, ये कौन सा style है बाबा भाई, इधर पूरा cover करो. But
क्या
it is,
रखे?
they don't realize. See, we have delivered at least 27 COVID positive patients, and the fact that we've had so many, and only 2 I think were symptomatic, all the others were asymptomatic, where their own doctors refused to deliver them. They got referred to us and we have delivered them. So you don't know whether you're carrying the virus or no unless you get checked. So it's easier to be safe rather than sorry. My take for everybody is, please, whether you're pregnant or no, precautions have to be taken, because precautions are much, much better than cure at the end of the day. But having said that, if you are COVID positive, there is nothing to get worried or scared about. If you are not due for delivery, then you go into quarantine for 14 days. You come to the fever clinic, we check you, we do all your tests. Your tests are repeated on the 5th day and again on the 10th day to make sure that there is no problem whatsoever, because you tend to desat or you tend to have changes or worsening by between day 5 and day 10. If you have survived day 10 with no complications whatsoever, trust me, COVID is like aake chala gaya aur kuch pata bhi nahi chala.
Okay.
But if there is somebody who has had fever, that is a symptom. If you have thoda sa gale mein kharoch, that is a symptom. You have got khasi, that is a symptom. Your breathlessness, that these are all symptoms. People buying an oximeter and checking their oxygen levels, it makes no sense. Arey yaar, pehle din thodi na wo kam hone wala hai. If it has to, it will be on day 5, between day 5 and day 10, and by then you will have access to a doctor somewhere, na? So please don't get scared. Do not just keep popping Dolo tablets, especially if you're pregnant. Come to the hospital, let us check you. Is there a risk? If you are not due for delivery, there is zero risk or fear to get worried about कि आपका life threatening कोई problem है. You only need to quarantine, and the reason to quarantine is you're protecting the people around you and you're not spreading the infection. If you are due for delivery, you are 38, 39 weeks and the COVID comes positive, then yes, there are chances of the baby having a problem. There are chances of baby developing fetal distress. There are chances of the baby having sudden intrauterine fetal death, which is there for any viral infection. It is not higher for COVID, but it can happen to anybody. You have to take utmost precaution. You have to get checked or get admitted in the hospital. Is normal delivery contraindicated? No, it is not. Happens that you can, if you go into labor, you can comfortably deliver normally. But for those who were incidentally going to be taken up for cesarean and the COVID came positive, then you were anyway choice for a cesarean. So you safely can undergo cesarean section under anesthesia. But that time we will see that we don't give you general anesthesia. We give you spinal anesthesia, which is in the back, so that your lungs don't get affected in any form. What about breastfeeding? You are given the baby, you have to wear a mask and please continue breastfeeding. Wash your hands before you touch the baby. Baby is not to be isolated into the intensive care unit, because then breastfeeding suffers, and the amount of antibodies that the baby can get from you, nothing like it. Please make sure that you keep the baby with you, unless of course it is indicated and the baby requires hospitalization or intensive care. Please keep the baby with you and encourage breastfeeding. Of all the patients that have delivered, only one baby came COVID positive. All the other babies are negative and all babies are doing perfectly fine. So for any patient, just the fear that what will happen if I'm COVID positive? Arey kuch nahi hoga. You come to us, we will deliver you.
Superb. मैम मैंने सुना कोई इंटरनेशनल यू टेक इंटरनेशनल क्लाइंट्स आल्सो. बहुत सारे लोग सिर्फ बोलते हैं 9th मंथ में आपके लिए आ जाते हैं कि मैम सब देख लेंगी. ऐसा कोई कोविड केस भी आया क्या आपके पास?
नहीं, कोविड इज नॉट अलाउड ना, इंटरनेशनल फ्लाइट्स ही बंद है, सो दैट इज नो क्वेश्चन.
करेक्ट करेक्ट. और नॉर्मल जो आपने लिया है कोई भी केस अभी जो, या इंटरनेशनल में मुझे आप बताइए ना, आप जनरल नॉन कोविड भी जो आपके पास क्लाइंट्स आते हैं उनके बारे में थोड़ा सा मैम मुझे बताइए.
अरे वो तो आते ही रहते हैं. सी आई हैव बीन इन हिरानंदानी हॉस्पिटल फ्रॉम द डे hospital been full 60 years. I have had clients who from here who have got delivery, patients who come here on medical tourism for hysterectomy, surgeries, trios. So those are lots of them. There is nothing different about it. You just do, and India is definitely medically much more feasible for international clients than abroad, because medical treatment abroad is very high. The cost wise is very high, so they like to come here.
Okay,
But saying that, I now am actually delivering patients who are from Bombay, who have come to me because their own doctors refuse to take them, which is what I feel bad. I said, no, आप किसी के पास गए और last minute में आपका COVID positive आया, फिर उन्होंने भेज दिया. So that is the reason why I started. About international, the first COVID that I did had actually come to stay in her brother's house, and she had registered in South Bombay. But she was for cesarean. Previous cesarean was already done 4 years ago. So this time she was for cesarean. I took her because the doctor, the hospital which she had registered in, refused to take her. So I operated on her.
मैम, बट ऐसा मतलब आप इतना अच्छा काम कर रहे हो, ये पर बाकी डॉक्टर्स क्यों नहीं उतना ध्यान दे रहे हैं मैम?
See, I have the infrastructure in Hiranandani Hospital.
So that means I have का support आपको इतना strong बना रहा है.
Yeah, that is because I have been here from day one, so I know exactly what is what. If you don't have the infrastructure, then you're putting other patients and yourself, your staff at risk also. So people get scared. And secondly, is when I was in Vadia Hospital, I used to be in charge of HIV unit many years ago. So वो exposure हो गया तो COVID लगता है हो जाएगा, no problem.
ये बात है. Though it is an unseen danger, but आपने थोड़ा बहुत ऑलरेडी एक्सपीरियंस कर लिया है, इसलिए इतना कॉन्फिडेंस आपके अंदर है. एंड आई एम श्योर माय ऑडियंस लाइक, अभी तो बॉम्बे मतलब डॉक्टर अनीता सोनी, मेरे हिसाब से तो आई वांट टू मैम, नहीं तो अगर मेरा कोई चांसेस होता तो मैं भी वहीं पर होती.
More than welcome. It doesn't have to be only for babies, it can be for anything. Yes, everybody is more than welcome.
Definitely. Gynec visit, yes, definitely I should visit once.
My only take home message today for everybody is, please don't get scared. Standard procedures have been described by the government. Lockdown was implemented to control the spread. It was not the cure for COVID. COVID has got no cure because it is an RNA virus. It is only thing that is working right now, like is the antivirals like remdesivir and if you have the cytokine storm, then tocilizumab. But beyond that, not very good results with all the other medications that people are talking about. As far as that is concerned, there is nothing else. It is only precautions that will help everyone more than anything. Being pregnant does not put you at higher risk, but you have to still follow the precautions because you are also autoimmune. 50% of the pregnancy is your husband's, which you have accepted in your body. So your immune system has gone 50% to accept that pregnancy. So that is why you can be more prone. Like if anybody in the house picks it up, yes, you will be the first person to come COVID positive. So precautions are always best taken. Avoid unnecessary going out. Stay in your 2-kilometer radius. The government is not stupid to come up with a lockdown. The last time we had these kind of rules was in the emergency. After that, we've not had such stringent rules. But I must say that the government has done a fantastic job of controlling. Because if you see what happened in Italy, you see what happened in America, we are way better, and our population is practically God knows how many times theirs. So in spite of our population and social distancing not being possible, we're still getting better results and we're seeing better recovery rates than other countries.
Agreed, ma'am. Because हम लोगों ने सही टाइम पे डिसीजन लिया, लॉकडाउन बहुत स्ट्रिक्टली कर दिया, अपने प्लेन्स बंद कर दी, सबसे ज्यादा मेजर जो कम्यूटिंग होती है जिससे
trains, buses, offices. So work from home. I keep telling everybody, you have to just be cautious till December 2020. Please, as all those who can work from home, continue doing so. Think about making money in 2021. 2020, your mission, mission is stay alive till 31st December 2020.
True. To stay alive and kicking, stay at home, till December you are saying, मैं तो March तक for kids, मेरे जैसे school kids हैं या teaching के लिए when we meet kids, I feel March तक मैम ज़्यादा safe रहेगा कि
let us
please
see how
थोड़ा
it
सा.
is. See, right now, what you're looking at, the numbers that were actually predicted for Bombay City, we've done much better.
Okay.
Our infection rates are controlled. Our screening has become more aggressive. We are doing a lot more testing. In between, you could not test. Even we were not allowed to test patients as much. Now you can walk in and say, I want to get tested for COVID. So a lot is available. Our experience compared to March, we are way better now in July than we were in March. We are more aware of, we never had seen patients with 12 liters and 15 liters of oxygen. We used to say, isko intubate karo, isko bahut oxygen lag raha hai. We are now realizing that no intubation, give them high flow oxygen, they'll do much better. So our approach to a lot of things has changed. So you don't have to get scared. We are all learning. It is the first time it has happened. I'm telling you, we had never imagined. But a lot of us, because we took the initiative, at least in Hiranandani Hospital, we were the first private hospital that said, dekhenge, we'll take it, we'll do it. So, and we've done very, very well for ourselves. So what I feel is there is nothing to get panicky or worried about. We've all done much, much better than we anticipated. It is a matter of time. The vaccine, when it comes. But even without that, as of today, our numbers are going down. They are more or less stabilizing. I think life will be a lot easier in the coming months.
So basically awareness बढ़ रही है, people are taking care, and you being medically equipped, well equipped, आप लोगों ने सारे मतलब care already लेते हैं, तो लोगों के अंदर मैं शायद आप आपके हिसाब से walk in या appointments increase हो रहे होंगे compared to जो पहले कम हो गए होंगे.
Hanji, we were not taking now, like every day till about 5 o'clock, we will see 15-20 patients, which is not bad. Otherwise, we used to see, my daily OPD would be 50 patients. Now we've cut down our numbers, but it is helping us because then there is lesser exposure, because it is not the hospital. It is now, if you are an asymptomatic person, you are in a crowded room sitting, वो बगल वाले को तुम ही दोगे ना, फिर क्या होगा?
प्रसाद दे दोगे आप तो.
Exactly.
मंदिर में आए हमें प्रसाद मिल गया, ऐसा हो जाएगा.
So it is basically meant for everyone. Please take extra care. Please take a lot of care. Look after the people in your vicinity, in your family, in your home. Same person goes out all the time. Precaution when they come back. Wash their hands, wash their feet. Footwear outside the house. Head straight into the bathroom. Sabke kapde, like is our hospital clothes get soaked in 1 dhakkan of Dettol, in hot water of 60 degrees approximately. We put the geyser on for 1 hour, soak our clothes, and then we put it in the washing machine to wash. So these are the precautions that we are all taking to prevent any infection being brought home. But other than that, it's the same for everyone. Please try and order online rather than going to supermarkets. Malls are going to open from 5th of August, I heard. But I would say, wait. Don't be in a tearing hurry to rush to malls and rush to wherever. There are parlors which have opened, and I, for one, in our area can swear that the Lakmes have come out with very, very good techniques and precautions, and they're following everything to international standards, and they're giving appointments. They're not allowing people to walk in. So there are parlors like that. So you go to places which have the basic know-how of managing and protecting. So the minute they do that, they protect you from any infection. So you don't have anything to be scared or worried about.
So please, if you want to go out, please go out when required. And parlors भी, every lady wants to go. ना जैसे मैम ने भी बोला मैनिक्योर नहीं हुआ मैम का.
नहीं हुआ है.
She needs care, so मैं आपके लिए कुछ booking करा देती हूँ मैम, services.
Thank you, but to be very honest, see, all of us have to live finally. This is going to be a way of life. This is the new normal. So if this is the new normal, it is easier to take the right precautions than to just go blindly. Like the other day I found somebody, madam मेरे को बाल color करने हैं. बोला बाबा, तो you go somewhere where there is enough precaution being taken. हमने भी नहीं कराए. It's okay. I mean, I have no problems aging gracefully, but if you are very conscious about it, then go to a place which is extra cautious, then go to a place which does not have that much of precaution. फिर तुम बोलोगे कि COVID हुआ, and not only are you exposing yourself, then you're exposing so many other people in the house also. Na? It is the younger generation that is not having problems. It is the older generation who's getting infected from the younger generation.
जो रिकवर हो जाएंगे, पर ये रिकवर नहीं होंगे,
ये रिकवर हो नहीं रहे, और फिर हम लोग धज्जियां उड़ा रहे हैं हॉस्पिटल्स के, डॉक्टरों की. But that is not required. It is not anybody's fault. It is the younger crowd that is going out. They are bringing the infection home. They may be asymptomatic carriers, but the problem is happening to the older population who are hypertensive, diabetic, obese, all the rest. वो थोड़ा सा age related होता ही है.
तो youngsters अपना experience लेके older people को थोड़ा affect कर रहे हैं. So better take care both the sides, respect them.
Absolutely, absolutely.
मैम एक चीज मेरे को क्वेश्चन मेरे दिल में था कि मैम ये रिकरिंग रिलैप्स होता है क्या कोविड?
See, COVID हमने किसी ने देखा नहीं है, but because we are seeing that it is coming back, and there are reports in literature and from other countries that they are getting reinfected. There are people who are talking about people who are coming back. Like the other day before yesterday, I think, in the fever clinic, there was a patient, a doctor, who came back with 50% of his lungs completely fibrosed because of COVID. And he had COVID a month ago. It is seen. Now, we don't have too many numbers. We don't have too much in terms of literature. But yes, it is happening. So we all have to be extra careful about it.
So, जिसको COVID हुआ है, they need to take extra.
Oh yes, I am still on medication, Raja.
Okay, okay. नहीं, but ma'am, आप medication पे हो, fine. Because this is for the people who are already had COVID and they are now recovered. Okay. बट उसके बाद भी, मतलब उसके 15 days बाद भी, उसके 1 month बाद भी उनको प्रिकॉशन लेना है.
Oh yes, oh yes. Just because you've had COVID once doesn't mean you let loose and start enjoying yourself. Same precautions जो मैंने आपको बोले for non-COVID patients have to be followed even by patients who have had COVID earlier.
तो मैम अगर घर में प्रेग्नेंट लेडी है, उसको कुछ नहीं हुआ है, उनके फैमिली मेंबर्स में से किसी को कोविड है, वो ठीक होके घर पे आ गए हैं, तब भी उनको घर में क्या करना है सिचुएशन?
No, so if you've had COVID and you are in the same house, that person will have to go into home quarantine. Home quarantine is, you have to have a house which is big enough where the infected person is given a bedroom along with a bathroom, isolated. No pregnant woman can enter that room. Nobody in the house can enter that room. There is a table which is expected to be kept outside the room on which the food is cooked and kept there. The plate has to be washed by the patient herself or himself and reused again. Food best is kept in disposable containers, so those are washed. So no crockery and cutlery is used for a COVID patient, because there is always that chance of transmission from even while washing the bartan or washing the cutlery and crockery. So best is to use your thermocol or your disposable plates, disposable wooden spoons, and throw it out. It is all kept and packed in garbage, which has to be labeled as COVID patient. So then the municipal corporation carries that garbage and it is all burnt. And that has to be carried on for max of 21 days. Because a patient can be infectious for 21 days.
So ma'am, ये बात मुझे बहुत ऑफ लेटली मेरी एक डॉक्टर फ्रेंड से पता चली थी कि गार्बेज सेपरेट, जो आपने अभी मुझे बताया कि गार्बेज उनका सेपरेट रहता है. इट कैन नॉट बी टेकन बाय द नॉर्मल पर्सन हु कम्स टू क्लीन आवर.
You have to keep it in a plastic packet and it has to be tied off and it has to be labeled COVID positive, so that they do not have exposure unnecessary, because उनको भी protection तो लगेगा ही ना, otherwise those guys are at risk.
So basically वो BMC के लोग लेके जाते हैं वो गार्ड.
BMC के
सेपरेट आता है उसके लिए.
हाँ जी.
पता चलिए. तो ऑडियंस, ये बात बहुत इंपॉर्टेंट है. अगर कोविड पेशेंट घर पे है, क्वारंटाइंड है, and you need to take care, you need to keep the garbage separately. I hope awareness आपको दी होगी, but this is for people जिनको अभी उस बारे में आइडिया ही नहीं है, मैं उनको बताना चाहती हूँ. So please take care, क्योंकि ये छोटी छोटी चीजें ही आपको सेफ रखेंगी. बड़ी बड़ी चीजें तो बहुत देख ली अब सब लोगों ने. मैम मुझे बताइए, जैसे बेबी अगर कोविड पॉजिटिव होता है तो उसका क्या मतलब
See, I will talk to you about, I mean, there are two scenarios. One, the mother is COVID positive. Two, the mother is COVID negative. Our first baby that we sent was only 18 hours old, who picked up COVID and then had fever after normal delivery. Came to us from somewhere in Kurla, was admitted in our hospital for 17-18 days, turned COVID negative and went home. That baby had high fever, had lung infection, had lots of problems, but went home absolutely fine. So that is the only baby that we had which was really very, very bad. But if, see, now you have to be able to diagnose it. At the moment, any fever is diagnosed COVID unless proven otherwise. मान के चलो, because otherwise you would think that it is a छोटा viral fever, crocin दिया, calpol दिया, और फिर पता चला कि no, that is not it, and it is something else, और problem हो जाता है. So it is very, very important that these children are investigated immediately and taken care of immediately, so that they can also go into isolation and or treatment, because these babies can also develop pneumonias, which then they require oxygen and have problems because of that.
Ma'am, ये baby की care, mother cannot be with the baby?
The babies are in the intensive care unit, required oxygen. So in our hospital, required to be in the intensive care. So the mother was not there. The mother came, used to come, talk to the doctors. And when we started breastfeeding was after day 12.
Okay.
Because the mother was negative. Otherwise, the mother also could get positive, no?
True. तो ये बहुत मतलब स्पेशल और बोलते हैं ऐसे मोमेंट्स है जहाँ पर कैसा सिचुएशन होता होगा मैम. आई रियली
जो सिचुएशन है बेटा, हमको उसमें से निकालना ही है. वी हैव द बॉटम लाइन इज वी हैव टू बी एबल टू सेव द पर्सन, सेव द चाइल्ड, सेव द मदर, एंड मेक श्योर दैट एवरीबॉडी गोज होम एंड इज डूइंग वेल.
So you are doing wonderful job, fabulous job. Time तो कैसे चला गया पता नहीं चला. It's already, I think, 4:48, so 50 minutes we have already been talking. We have this 10 minutes in our hand. मैम रिविजन करेंगे, बिकॉज ये आपने हो सकता है कुछ लेट ज्वाइन किए हो. एक रिविजन तो ये है कि मैम कोविड के टाइम पे एक प्रिकॉशंस जो हमको लेने हैं. वन, वी विल रिवाइज एंड जस्ट गिव एन अवेयरनेस मैसेज टू ऑल. दैट इज वन विच आई वांट यू टू टेल देम. टू इज डरे मत, प्रेगनेंसी के टाइम पे भी थिंग्स कैन बी टेकन केयर, एंड चाहे वो फर्स्ट ट्राइमेस्टर हो या लास्ट हो, they are being well taken care. Third, just मेरी जो friends के question थे कि 40 के बाद भी आज अगर किसी को examine करने जाना है तो they can go and they should, but menopause is more in 49 and 50s, right ma'am?
Yeah, perfect.
अब आप message दीजिए मैम, मैंने अपनी
okay
पूरी कर दी.
So we'll start with your first part, which is for the patients who are pregnant and whether COVID can cause them, like the Avneet, baby Avneet, whose story we are actually talking about today. It is extremely important to realize that not everybody will be COVID positive. Not everybody who is COVID positive has symptoms. Baby Avneet's mother had nothing, was incidentally diagnosed as COVID positive and was posted for a cesarean section, was then investigated for a cesarean, came out COVID positive and had to be operated on, so which we successfully did, and we discharged the baby and we had no problems. That is as far as today's story goes. But not everybody is so lucky. You might have a mother that has fever and presents to you with fever and has been investigated and is COVID positive. Is there anything to get panicky about? No. Please come to the hospital. There are doctors who are operating on COVID positive patients. So is there anything to get scared about? Can a COVID positive patient deliver normally? Yes, can deliver normally, can have a cesarean, but you need to have the infrastructure to be able to support them. Separate operation theaters, separate staff, adequate amount of people, PPE, lots of equipment is what is required for these patients, and it is the bigger hospitals that have better exposure than the smaller places, because there is a lot of infrastructure required to support these COVID patients. Having completed that, is a COVID positive patient allowed to breastfeed? Is asked to breastfeed unless the baby requires isolation or intensive care unit, because the antibodies that come from the breast milk from the mother to the baby help protect the child rather than anything else. The only problem that a COVID positive mother has is the isolation. जो 5 दिन या 7 दिन hospital में alone learning to manage with a newborn baby, where everybody has the expectation कि सास रहेगी, माँ रहेगी, husband रहेगा. एक तो COVID दुनिया में होने के वजह से very few mothers and सास are reaching on time. उसके ऊपर से if they have to be in isolation and the husband is also not there, तो वो लोग सारे रो लेते हैं. It kind of gets on to you. So you have to be strong. You cannot run away from it. Unfortunate, it is what it is. You should take care. The second thing is, if there is anyone who's COVID positive in your family, there is a very high chance a pregnant patient will pick it up. So please learn to isolate, quarantine, be careful so that you do not have any problems. Turning COVID positive, young patients are the ones who are pregnant. Young patients are the one, if they turn COVID positive, everybody knows that it is not life-threatening. So there is nothing to get panicky or worried about. Can you come out of this comfortably? Yes. The older you get, the worse your chances. Does it mean that young people are not having problems or are not dying because of COVID? No, it doesn't mean that. The doctors, the healthcare professionals, the policemen, the BST guys, where our exposures are much higher, these are the people at higher risk because our viral loads are high. So we are the ones that have more life-threatening problems than normal population. But young people also are dying not because they went into the hospital, they're dying because they came to the hospital late, treatment was started later, they were investigated later, and hence they succumbed to COVID. Otherwise, COVID is like any other viral infection where you can comfortably go home. That is as far as pregnancy, COVID, hospitalization. Please don't get scared. If you have a problem, approach a tertiary care center. Patients are coming late to the hospital, hence they are getting diagnosed late. Like small things which can be treated easily are becoming advanced or becoming untreatable because of delay in presentation by the patient, because of fear of picking up COVID in a hospital, which is absolutely unfounded. Please go to a hospital on time. Doesn't mean you go walking, hello, I came to say hi to you. Doesn't mean you are allowed to go to a shopping mall or to a supermarket or whatever. If you have a medical problem, please don't ignore it. Please go to the doctor, because you need to get investigated and you need your treatment to be started as soon as possible. As far as the older patients are concerned, post 40, simple zinc, vitamin C, B complex is more than sufficient as far as your treatment is concerned to help build up your immunity. Kadas, Ayurvedic kadas, which have ashwagandha and recipe, your tulsi leaves and honey and ginger, all of that works. Steam twice a day, especially when you've come back from outside, definitely helps, because the heat, like we said, for kapda also you want hot water. Here the steam is heat. It goes in, the virus does not survive. If you are around anyone, you sneeze into your elbow, not into your hand. Hand hygiene, or wash your hand ever so often. Face mask, not the wild ones. Simple 3-ply mask is what you require every time you go outside. You do not require anything more than that. This is for everybody, including the 40 plus. Especially for the 40 plus would be calcium supplementation, vitamin D, which is precautionary in the perimenopausal age group. Because you're perimenopausal, you can have menstrual complaints, you can have irregular bleeding, you can develop cancers, which are known to women in the elderly age group. So Please go to your doctor, get your routine checkup done. Don't delay because of fear of COVID.
पूरा निचोड़ लिया मैम मैंने तो आपको. I hope my audience have taken मतलब जितना चाहिए. शायद मैंने कोई एंगल छोड़ा है क्या आपसे बात करने में?
मुझे नहीं लगता. I think I have 1 hour non-stop. मैंने सबको बोर कर दिया है.
नहीं मैम, बोर नहीं किया मैम. मैं गारंटी दे सकती हूँ जो अभी देख रहे हैं और जो बाद में देख रहे होंगे, बिकॉज मैं आपके साथ ना एज अ होस्ट तो बैठती ही नहीं हूँ. मैंने आपसे डिस्कस किया है. मैं एज अ पेशेंट या अपने फ्रेंड्स, बिकॉज मेरा फ्रेंड सर्कल इतना है ना, कमी नहीं होगा आप इस बात की कि क्वेश्चंस इतने हैं, तो मैं सबकी तरफ से जितना लगा मैंने आपसे पूरा निचोड़ा है.
Good. I'm glad I could have been of help to you. And if this information can be passed on, and please, through you, through your friends, any woman you feel has picked up COVID, is pregnant and is worried, please give her my contact number. Please tell them free to come to Hiranandani Hospital. Don't think about the money and this and that. It's all standard right now. Please, if you can afford it, come, or Nair Hospital, Nanavati Hospital, because there are people like me who are willing to help. Don't get scared. Don't get panic. Use logic. Everything will work well.
Definitely. So, my dear audience, my friends, my family who is watching this, Dr. Anita Soni has openly invited you. कोई भी problem हो, gynec related, pregnancy related, she is there for you. And as a human being also, she is there for you.
Anytime.
You can follow her on her Facebook or Insta IDs, and कुछ भी है, you can comment it, and हमारे जरिए भी आप messages दे सकते हैं, which we will give it to her. बोलते ना, रूबरू होके हम digitally देंगे मैम को, और जब मिलेंगे तो मिलेंगे मैम.
When things change, we shall meet.
We shall meet over a coffee or whatever you like to have.
Done. Anytime.
Definitely. And
thank you for having me over. Thank you for inviting me. I hope I've been able to help as many people as we can get across, and pleasure.
Ma'am, thank you so much. मतलब मेरे पास words नहीं है, but I will still say you have been a fab speaker with us. You have been a fab doctor. जो लोग और मेरे जो doctors friends है जो देख रहे हैं, I hope they will also get inspired. We can inspire the other doctors कि आप भी fear मत लाओ. See a fearless doctor, unseen dangers को वो देख रही है, unsung warrior है. आज हमने उनको सुन लिया. I don't think उनके पास इतना time होता होगा सुनाने के लिए. She is working, morning till late nights. इतनी OPDs, इतने patients, continuously she is working. तो ये जो हमने आपके साथ रूबरू discussion किया है, I hope it has been knowledgeable for everybody who's watching us. So ma'am, thank you. मैम कुछ शेयर करना चाहूंगी अपने नेक्स्ट एपिसोड के बारे में जो हम लोग करने वाले हैं. ऑन संडे वी हैव द थर्ड एपिसोड ऑफ अगेंस्ट ऑल ऑड्स. दैट्स अ सीरीज व्हिच वी आर डूइंग मैम. पॉडकास्ट के थ्रू हम कर रहे हैं. नॉर्मली पॉडकास्ट के थ्रू करना चाह रहे थे. सो इसमें जो हमारी स्पीकर है उनका एक स्पेशल कोट है, एवरी डे इज अ गुड डे व्हेन यू रन. ओके एंड फ्रॉम अ हाउसवाइफ टू एन एथलीट की जो इनकी journey रही है. she's into Zumba, she's Reebok, she's Bolly Beats trainer. So I am inviting all of you to join on my Sunday session, which is 6 p.m. live. Miss Deepa Katrodia will be with us. She will be sharing her journey. So ma'am, ऐसे speakers को हम बुला रहे हैं या जिनकी stories उसने unheard है, and जिनकी stories सुन के लोगों को inspiration मिलेगा, motivation मिलेगा. तो आप लोग live heroes हैं, and these are people who are inspiring.
I can't wait to start my activity again. I'm still hoping my lungs come back to normal soon, because वो COVID के बाद it's very difficult even walking. I mean, simple thing like I used to walk as much as I could, 5 kilometers at the speed of 6.5. अभी तो थोड़ा भी नहीं चला जाता. I get breathless. So I'm just waiting.
Are you meditating or doing breathing exercises for this?
I have spirometer.
Oh.
My brain functions too fast, so meditation, it just doesn't happen with me, because the minute I try to do something, I'm thinking of 10 other things. So I've been given by my physiotherapist the spirometer, and I have to every 3 or 4 hours blow into this 20 times to help my lungs improve.
Ma'am, I will pray for you that you recover very fast. बोलते हैं ना मेडिटेशन इट्स नॉट अ कप ऑफ टी ऑफ एवरीबडी, ऐसा यहाँ पर हमारे फ्रेंड्स भी बोल रहे हैं, बट मेडिटेशन इज मैम व्हाट आई बिकॉज व्हेन आई टीच माय पीपल बिकॉज आई एम इनटू स्पिरिचुअल गाइडेंस दैट मेडिटेशन डजंट मीन कि आप कंटिन्यूअसली बैठ के एकदम स्ट्रिक्टली ऐसे करो, नो, मेडिटेशन इज व्हाट यू लाइक, डू व्हाट यू एंजॉय, जो
So I
चीज
enjoy to work.
yes yes
So मेरा
that
काम
is
is
your
my
meditation, but
so my meditation is going to work. It's not sitting and breathing. I can't do that.
तो मैम वो बिल्कुल रिवाइव हो जाएगा, आई विल विश फॉर यू, बट
Thank you.
थोड़ा सा बोलते हैं ना 5 मिनट आंख बंद करिए, थॉट्स आएंगे, थॉट्स जाएंगे, आपको सिर्फ आईज बंद करके ना इधर कॉन्सेंट्रेट करना है, यू ट्राई फॉर 5 मिनट्स, कितने भी थॉट्स आने दीजिए, आप ब्रीदिंग पे कॉन्सेंट्रेट करिए, स्पीडोमीटर भी नहीं जरूरत पड़ेगी थोड़े दिनों में, आई विल विश फॉर यू एंड हम लोग अपना स्विच वर्ड बोलते हैं डिवाइन मैजिक बिगिन नाउ 28 टाइम्स आई विल प्रे, यू ऑल्सो से 3 टाइम्स अ डे, जैसे आप गोली खाने को बोलते हैं ना सुबह दोपहर शाम, ऐसे ही डिवाइन मैजिक बिगिन नाउ, दैट्स
Done
माय
deal.
विश फॉर
Divine
यू,
magic begins now.
यस एंड
Thanks to you.
विद एन इंटेंशन दैट ये सारी चीजें ठीक हो जाएंगी,
Done
ठीक है,
deal. Thank you so much. Thank you.
थैंक
God
यू,
bless.
थैंक यू सो मच माय डियर ऑडियंस, फिर मिलते हैं ये संडे 6 PM, प्लीज बी देयर, नेक्स्ट संडे का भी बहुत ही अच्छा सरप्राइज है, आई विल शेयर विद यू, नेक्स्ट फ्राइडे स्टोरीज विल बी अपडेटेड, आप हमारे साथ बने रहिए, जुड़े रहिए, थैंक यू मैम, गॉड ब्लेस
God
यू,
bless.
लव, गेट वेल सून, वी
Thank
ऑल
you.
वांट टू सी यू रनिंग